Chapter 9 is over geriatric care. So, aging is a process that begins at birth and ends at death. It's a normal process and it leads to normal changes in our body. Gerontology is the scientific study of aging and the problems with the elderly. Geriatric care is the care that we provide to older individuals. Through gerontology, we've also found a lot of facts about aging, but there's also myths regarding aging in the elderly. And as healthcare workers, we have to know the difference between the facts and the myths. A myth is a false belief. One myth is that anyone older than 65 is considered old, right? The fact is that old isn't determined by your age and numbers, it's determined by how you think, how you feel, and how you behave. Lots of people that are over 65 are still very active and very productive. My aunt was a nurse practitioner. She retired on her 70th birthday because she was financially ready to be done working. She's definitely not, old in quotes. So now she has more time to travel around the world and hang out with her grandkids. There's nothing old about her. Over the weekend, I had a 93-year-old woman as a patient who was able to walk and take care of herself. And then we have 70 and 80-year-olds in CrossFit. In the past, I've had nursing home patients that are in their 50s and are completely debilitated and unable to care for themselves. So old is, not just the number, the age you are, it's how you feel. Another myth is that elderly people aren't competent and they can't make decisions anymore. The truth is that they have great experience and knowledge. There might be issues with confusion or something medical, but just because they're elderly doesn't mean they can't still think for themselves. Another myth is that all elderly people live in poverty. And the fact is that less than 12% of people over 65 live at that poverty level. Another myth is that most elderly individuals are cared for in institutions or long-term care facilities or nursing homes, if you will. The fact is that most older people live at home or with family. About 5% live in long-term care facilities. Another myth is that older people are unhappy and lonely, when the fact is that many elderly people socialize by being involved in charity or volunteer work or at church or whatever. Another myth is being old means being sick or disabled, when in fact most elderly people are in good health. Another myth is that elderly people don't want to work. Their goal is to retire. The fact is that many elderly people prefer to work into their 70s and even 80s. I don't know. For me personally, my goal is to retire, but to each their own, right? Another myth is that retired people are bored and have nothing to do with their lives, when the fact is that retirees are busy with hobbies, travel, church, family, and community. See, that's why I want to retire. I want more time with doing my hobbies and traveling and spending time with my family. So there are physical changes that occur with aging. As aging happens, certain physical changes happen in everybody. These changes are a normal part of aging and they're usually gradual, so kind of slow moving. Most physical changes of aging involve a decrease in the function of the body system. Diseases can increase the speed and degree of the changes. Lifestyle, nutrition, economic status, social environment, and limited access to medical care can also have effects. So I know he's just said that aging is not necessarily the number, or sorry, that being old is not necessarily the number. It's all about how you feel. And a lot of times, the way we feel and our health and everything is changed by lifestyle, nutrition, and all of that. So, different systems that are affected by aging, the integumentary system, remember that's your skin. Some of the most obvious effects of aging happen here. The production of new skin cells decreases, our sebaceous or oil and sudoriferous or sweat glands become less active, circulation to the skin decreases, hair starts to lose color, you might even lose your hair. The skin loses elasticity, and we start to see these senile lentigines or liver spots. Actually, they have nothing to do with the liver. They're dark yellow or brown spots that develop on the skin as aging occurs, and that has more to do with the melanin or that pigmentation in your skin kind of moving and being deposited in different areas. Good skin, nail, and hair care is essential, especially as people age. The musculoskeletal system, the muscles lose tone, volume, and strength. Some issues related to the musculoskeletal system are osteoporosis. It's a condition where calcium and other minerals are lost from the bones. Arthritis, which is inflammation of the joints. Gradually, people lose their height just by a few inches, not like anything major, but they also have decreased mobility and weakness. In the circulatory system, the heart muscles become less efficient at pumping blood into the arteries, and cardiac output decreases. Blood vessels will start to narrow and become less elastic, and blood flow to the brain and other vital organs might decrease. Elderly people are also more at risk for thrombus, which is a blood clot. In the respiratory system, the respiratory muscles become weaker. We have some issues like emphysema, where the alveoli lose their elasticity. Remember, the alveoli are those little, if you draw the upside down tree of the respiratory system, they're the little leaves at the end. They look like a cluster of grapes. This is where that gas exchange of carbon dioxide and oxygen happens. So they lose their elasticity. So we have less efficient exchange of gases. And then bronchitis or chronic bronchitis is where those bronchioles, those little twigs, become inflamed. So the airway is not as open and free flowing. There might also be changes in the larynx that affect the voice. In the nervous system, blood flow to the brain decreases, and there's a progressive loss of brain cells, and the senses diminish. Nerve endings are less sensitive, and short term memory loss can happen. We also see things like in the special senses, like in the eyes, cataracts. That's where the normally transparent lens of the eye becomes cloudy or opaque. It kind of thickens. That's you can see like the cloudy lens or the yellowing lens on the eye. And glaucoma, which is where the intraocular pressure of the eye increases and interferes with vision. Another special sense that's affected by age is hearing loss or ears. It usually happens gradually. Remember, anything related to age, whether it's a vision loss, that's presbyopia, hearing loss, that's presbycusis, that prefix presby, presby, just means related to age. In the digestive system, we have fewer digestive juices and enzymes that are produced. The muscle action becomes slower, so that peristalsis or that worm-like movement through the GI system is going to decrease. Elderly people may start to lose their teeth, and liver function may be reduced. They may deal with difficulty swallowing, which is called dysphagia. In the urinary system, the kidney structure decreases in size, so the kidneys become less efficient at producing urine. There's also poor circulation to the kidneys, which is related to that, or helps cause that less efficient urine production. The bladder function is going to weaken. They may begin to experience nocturia, which is frequent urination at night, and incontinence, which is the inability to control urination. The endocrine system, there's an increased production of some hormones like parathormone and thyroid stimulating hormone, and there's a decreased production of other hormones like thyroxine, estrogen, progesterone, and insulin. So several physical changes can happen related to the increase or decrease in the production of these hormones. The basal metabolic rate decreases, and there are changes in the endocrine system that occur very slowly over a long period of time. These are not rapid. You're not going to see these like all of a sudden. In the reproductive system, in the female, the vaginal walls thin and secretions decrease. The uterus can drop and the breasts can begin to sag. In the males, there's a decreased sperm production, slower sexual stimuli, and ejaculation takes longer. The testes actually become smaller and seminal fluid thins, so less is produced. Then we have psychosocial changes of aging. We just talked about physical, now we're talking about psychosocial. In elderly people, they also experience these psychological and social changes. Some of them cope well, others experience frustration and mental distress related to this. So, as healthcare workers, we have to be aware of these changes and stresses. So most adults spend a large portion of their days working. If you haven't noticed that yet, you will once you get to that stage in life. Retirement is often viewed as the end to their working years. Lots of people actually enjoy retirement, but some do feel a major sense of loss or some loss, like loss of purpose. Social relationships also change throughout life. In elderly individuals, changes can happen more frequently. Some elderly people adjust to these changes well, and some elderly people can't cope and become withdrawn or depressed. Changes in living environments can create some psychosocial issues as well. Some people leave their homes by choice. Sometimes there are financial problems or physical disabilities that can force people to leave their homes. Moving to a long term care facility can create stress, as well as moving in with family members or whatever that change may be. When you move into a long-term care facility or in with family or whatever, you lose autonomy. Autonomy is like the ability to decide things for yourself, making choices and pursuing a course of action for yourself. Um, they still may be able to make some choices, but when they live at home, on their own, they have complete freedom, and they lose that when they move. Lots of people or elderly people view long-term care facilities as like places to go and die. They don't see them as like, a place to, a happy place that they moved to go live in. Most individuals want to be independent and self sufficient. The elderly learn that independence can be threatened as they get older. They start to have these physical disabilities, potentially illnesses, and decreased mental ability that affects their independence and makes them more reliant on other people. Elderly people are more prone to disease and disability. Disease is any condition that interferes with normal function, and disability is a physical or mental defect or handicap that interferes with normal functions. When disease or disability affects the functioning of the body, someone might experience psychological problems. Sick people usually are scared, especially scared of death as they get older. There's chronic illness, there's loss of function, and there's pain. So lots of issues for elderly people facing disease and disability. And then we have confusion and disorientation. So most elderly individuals remain mentally alert until death, but some experience periods of confusion or disorientation. Delirium. This is something important to know. When confusion or disorientation is a temporary condition that's caused by a treatable issue. Um, so when we're talking about delirium, your patient or your resident is going to kind of act like they have dementia. Ooh, excuse me. Your patient is going to kind of act like they have dementia. But if it's delirium, it's temporary, it's reversible. So we have to find the underlying cause or the reason for this delirium. Sometimes it's, as simple as a urinary tract infection or not having a good sleep and wake cycle, like if they're not sleeping well at night and then they end up sleeping a lot during the day, or just not getting sleep. So if we find the underlying condition, we can fix it and reverse it. But disease or damage to the brain can sometimes result in chronic confusion or disorientation. So if we don't fix it, it can become a permanent issue. Um, so some causes of confusion and disorientation, we have a cerebrovascular accident or a stroke. This is an obstructed supply of blood to the brain or a ruptured vessel that causes hemorrhaging. Arteriosclerosis, where the walls of the blood vessels become thick and they lose their elasticity. And atherosclerosis, which is an accumulation of fat or mineral deposits on the inner walls of the blood vessels. So both of these would narrow the blood vessels so that an adequate amount of blood does not get to the brain. Transient ischemic attacks are temporary periods of decreased blood flow to the brain. Some people call these mini strokes. Dementia, this is also called a brain syndrome. It's a loss of mental ability. This is when we're talking about an actual stroke or dementia or Alzheimer's disease, these are permanent issues. Transient ischemic attacks are temporary issues. So Alzheimer's is a form of dementia that causes progressive changes in the brain cells. So dementia and Alzheimer's are progressive. They, get worse as the person gets older. They are permanent damage. Alzheimer's is viewed as terminal. It's an incurable brain disease that usually lasts from 3 to 10 years. That's a large span as far as time goes. But it is, it varies from person to person. Some people advance very quickly and some people advance very slowly. Um, So if you're caring for someone who is confused or disoriented, make sure that they have a safe and secure environment. Follow the same routine. We use reality orientation to help promote awareness of person, time, and place. But just know as the person gets older and advances in things like dementia and Alzheimer's, that reality orientation becomes less and less important as they, kind of go off into their own world. Sometimes that reality orientation can actually be harmful. So think of it this way. It's an example I like to give in some of my other classes. If you have someone who is normally pretty alert but kind of has a couple memory issues, not, nothing major, and they're confused about what day it is or whatever, then reorient them. Tell them, oh no, it's Tuesday, we do this on Tuesdays or whatever. But when you have someone who has pretty bad dementia and doesn't remember things, if you go and say like, hey Lucy, it's time to go for lunch, and Lucy says, oh, I can't go down for lunch, I'm waiting for my dad to pick me up. Well, Lucy is, in her 90s, so it's clear that her dad is not going to come pick her up. He's probably been dead for years. But we're not going to say that. We're not going to say, oh, Lucy, your dad's been dead for years. Let's go. Let's get lunch. Because that's just going to upset her. We're talking about, like reintroducing to her the fact that her dad has passed. So reorienting her to reality is not going to be very effective there. It's actually going to be more hurtful. And we see that a lot with people that have like lost a spouse or a loved one or something like that. We tell them, oh, your husband passed away. Don't, did you forget? And they don't have the ability to remember that. So that's really, really hurtful. We don't use reality orientation all the time as far as that goes. It can cause a lot of unnecessary pain. Instead, we would just kind of like go around it. So if Lucy tells me like, oh, I can't go to lunch, I'm waiting for my dad to get here, then I would probably say something more along the lines of, oh, he's probably running late, so let's grab something so you're not hungry. And then hopefully distract her from, that mindset that her dad is coming. We don't want to end up causing more harm than good. So continual assessment of the patient is necessary. We want to make sure that we understand the phase that they're in, and what their recollection abilities are and things like that. Because again, I don't want to cause more harm than good there. So providing care to the elderly can be very challenging, but also very rewarding. Elderly people have the same physical and psychological needs as others. We talked about Maslow's in the last chapter, that hierarchy of needs. A few factors have to be considered when we care for the elderly individuals, like culture, which we'll talk about in the next chapter. These are the values, beliefs, ideas, and customs, as well as characteristics that are passed from one generation to the next. Some other factors, spiritual needs, the beliefs and practices of an individual. So it's definitely important to understand that when you're taking care of people, not everybody is from the same culture or has the same beliefs. So it's important to just be open-minded and help facilitate whatever their needs are regarding their culture and their beliefs. Freedom from abuse is another important aspect of care. All states have laws that suspected abuse must be reported. In the world of healthcare, we say that we are mandatory reporters. So anytime we suspect abuse, we have to report that. That's mandatory. And it's definitely important to respect and follow the patient's rights. We have what we call an ombudsman. It's a specially trained person who works with the elderly and their families, as well as healthcare providers and other people that might be concerned to improve the quality of care and quality of life for our patients or residents. A lot of times the ombudsman steps in, they're like an impartial third party. So they a lot of times step in just to make sure that the residents are getting the care that they need and they deserve. And that is it for chapter 9.